Welcome. I am Dr. Lori Erickson, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the September 2012 print journal. This month's Editor's Choice manuscript is HIV Screening in the Healthcare Setting, Status, Barriers, and Potential Solutions by Drs. Rizza and Temesgen from Mayo Clinic Rochester, Minnesota, and McGowan, Purcell, and Branson from the Centers for Disease Control and Prevention, Atlanta, Georgia. In this article, the authors describe the status, barriers, and potential solutions to the adoption of the Centers for Disease Control and Prevention recommendation of routine screening for HIV infection in clinical settings. They describe the lack of awareness and misconceptions related to HIV screening by physicians and patients, barriers at the facility and legislative levels, costs associated with the testing, and conflicting recommendations concerning the value of routine screening. A video interview with one of the authors, Dr. Rizza, can be viewed at the homepage of Mayo Clinic Proceedings. Additionally, CME credit is available for this article. The article, Anti-Epileptic Drugs 2012, Recent Advances and Trends, by Dr. Servin and colleagues from Mayo Clinic, Phoenix, Arizona, discuss 5 new anti-epileptic drugs approved in the last 2 years for the treatment of epilepsy, 2 of which have novel mechanisms of action. 3 trends involving anti-epileptic drugs have become clinically important in shaping modern medical management of epilepsy. These trends include the use of pharmacogenetics to predict a serious adverse event, the limitations of generic substitution of brand name anti-epileptic drugs, and the issue of suicide risk involving anti-epileptic drugs. A video by one of the authors can be viewed on the homepage of Mayo Clinic Proceedings. The article, Bloodstream Infections in Patients with Pulmonary Arterial Hypertension Treated with Intravenous Prostanoids, Insights from Reveal, is by Natalie Kitterman from Intermountain Medical Center, Salt Lake City, Utah, and colleagues from 5 medical centers in the United States. The authors evaluated the rate and potential risk factors for bloodstream infections using data from Reveal, the registry to evaluate early and long-term pulmonary arterial hypertension disease management. They found that compared with intravenous eprostenol therapy, treatment with intravenous treprostinil is associated with significantly higher rate of gram-negative bloodstream infections. Dr. Singh and colleagues from Mayo Clinic Rochester, Minnesota, and colleagues from Guan and Men Hospital, Beijing, China, authored Derivation and Validation of Automated Electronic Search Strategies to Extract Charlson comorbidities from electronic medical records. They sought to develop and validate automated electronic note search engines through automated digital algorithms to identify Charlson comorbidities. They found these to be feasible and reliable. They noted the automated digital algorithm outperformed ICD-9 codes in all of the Charlson variables, except with leukemia. A video interview with Dr. Singh can be viewed on the homepage of Mayo Clinic Proceedings. An accompanying editorial by Dr. Mark Silverstein discusses this article and issues associated with automated digital algorithms and the electronic medical record. The article, Avanafil for the Treatment of Erectile Dysfunction, a multi-center randomized double-blind study in men with diabetes mellitus, by Dr. Goldstein from San Diego, California, and colleagues from Texas, Pennsylvania, New Jersey, and California, report a 12-week, multi-center, double-blinded, placebo-controlled study which randomized 390 men with diabetes and erectile dysfunction into 3 arms. One of the arms to receive Avanafil at 100 milligrams, 1 at 200 milligrams, and 1 to receive a placebo. They found Avanafil safe and effective for treating erectile dysfunction in men with diabetes, and side effects were similar to those seen with other phosphodiesterase 5 inhibitors. The review article, Suicide in the U.S. Army, by Dr. Lineberry of Mayo Clinic, Rochester, Minnesota, and Dr. O'Connor from the University of Washington, Seattle, provides an overview of suicide in the Army, synthesizes data from recent studies for better understanding of risk factors for suicide, particularly those directly associated with military service, and the application of these results to develop suicide prevention approaches specific to military personnel. A video interview with Dr. Lineberry can be viewed on the homepage of Mayo Clinic Proceedings. Again, please be reminded that the authors or co-authors of 4 of the articles we have discussed have provided video interviews which are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. There you will also find additional video interviews. Our homepage contains additional content not available in the print journal, such as extra residence clinics articles, medical images, stamped vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the September 2012 issue of our journal. Thank you for your continued interest in Mayo Clinic Proceedings. We are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. Please note that the October 2012 issue is set for release on Science Direct on October 1st, 2012, and on the Mayo Clinic Proceedings website on October 3rd, 2012. Please check back on that date to hear the multimedia summary of highlights from that issue.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.